film, depend on the person, maybe a film or book with a situation similar from the patient. And another kind of intervention is to act as if, I don't know if you know, but maybe in situations where the person is a little bit resistant or can't find a way to change, and well, then you encourage them to make an experiment to act as if you were safe, or as if you were different things.
Yeah, acting as if goes all the way back to Albert Adler. So that's a great one. And that one is an interesting one because you can do it with kind of an experiential twist, or it can be very much a behavioral it can be more like behavioral rehearsal. So I think that those are both really good examples. Ed, do you want to talk about fixed role therapy from personal construct psychology?
I think it's of the same vein here. This is George Kelly's work from the 1950s with personal construct psychology. It's just kind of you flesh out who you actually want to be. You spend some time kind of describing it, writing it down, and then you have, I believe it's usually a 2-week period where you're strongly encouraged to act out that role. So it's and supposedly that has pretty good results there. So that's kind of where I was going with the as if, though, but it's rather than something very specific, it's very general with what you're getting at.
Right, and as we all know, there are lots of good ideas that people have discovered or rediscovered from different perspectives and described in different ways. So thank you for those good, rich examples of how to work with actions in different ways and expanding your repertoire over time and trying to customize it to each client. So let me tell you a little bit about where we are. So on our first session, we talked about kind of working interactively and presented a big scheme of interactions. And then the last 3 weeks, we've looked at very specific ways of intervening, focusing on cognition, focusing on emotion, focusing on behavior. And as I pointed out a little while ago, my work with real clients is much more interactive than I don't say, I'm sorry, we worked on cognitions last week, we're working on something else this week, but it's more interactive. So what we're going to be doing next week is talking about those interactions. And one of the questions I want you to think about going forward, so 3 weeks ago, I taught you how to do a multidimensional survey, and I'm going to be covering that again next week. And particularly with new counselors, this is I usually am working with practicum counselors and interns, so it's a different question for you as experienced psychotherapists. With new therapists, they're often reluctant to do a multidimensional survey and say, where they would, identify the thoughts, actions, and feelings, and then say, where should we start? Because you can't say, where should you start? Please pick cognitions, pick cognitions. I don't know how to work with behavior or feelings. So are you ready to try and do that? So have we given you enough background in all 3 of these areas that you can start to poke around and do a multidimensional survey and ask a client where they want to start? And because that's where I'd like to encourage you to try that as a tool. And I've announced that we're going to do a couple discussion groups between level 1 and level 2, so that if you do have questions about how to do some of this interactively work, we can do that. But we're going to have time to discuss that next week. So I have a little less content and a little more time for discussion. So that's the question I want you to think about for next week. Are you ready to give the client the choice to focus on thoughts, feelings, and actions? And do you have enough skill to follow the client's lead in that area? So I want you to, that's something that we'll be doing next week. Mads is ready, so that we have at least one person on board. So, and I'm going to be sending you an email at the beginning of next week about kind of where we can go from beyond the level 1 training on cognition, emotion, and behavior, the level 2 training on external and internal influences, and more putting into practice. So I'm going to be offering more discussion groups on an ongoing basis and give you a chance to try and apply this work to clients and to write it up in a certain way and to look at your skills. So I'll be sending you that at the beginning of next week. Again, let me go back to the slides just to wrap up for a minute. So for the certification, after you've attended all 5 webinars or watched them on video, once they're posted, you can send me all 5 of your worksheets and I'll send you a certificate of completion for level 1. We'll do the same thing with level 2. I'm going to be offering a couple discussion groups at this time on June 24th and July 8th. We won't do that as a formal webinar through CEPI. I'll just send you a Zoom link through the TUP Dates Google group. Copyright and permission to reproduce. If you want to use these slides, please do so, but please give me credit. And if you want to use these in training, I'd love to hear from you, so please keep in touch. And there's my contact information. Any final questions, comments before we wrap up our behavioral focus for today? Okay, so I appreciate once again, I appreciate your interest. I appreciate your good questions. I appreciate your wisdom. So thanks for participating, and hopefully I'll see most of you next week. Have a good weekend, everybody. Bye.